Good afternoon. Of course, those were scenes from the Western Cape where Premier Windy was giving an update when it comes to their vaccine strategy and obviously outlining some of the issues that they are experiencing when it comes to the COVID-19 pandemic and the measures rather that they have in place. Of course, we will keep you posted as that unfolds, but for now, let's have a look at the headlines. The death toll from COVID-19 related complications tips over the 30,000 mark. 5 men accused of murder of 2 Limpopo businesswomen denied bail at the Polokwane Magistrates Court. England rolls out a coronavirus vaccine developed by Oxford University and AstraZeneca, seeking to lead the Western world on inoculation. South Africa's COVID-19 death toll has passed 30,000 after another 434 people died in the latest 24-hour cycle. The most deaths overall have been reported in the Western and Eastern Cape, with 7,716 and 7,352 respectively. The Health Ministry is also reporting a further 12,601 new infections. This takes the overall number of infections since the start of the pandemic to more than 1,113,000. Recoveries now stand at over 911,000 and active cases have risen to 171,765. The coronavirus infection rate in some areas of the Eastern Cape continues to rise. The province has seen 7 hotspots. Nelson Mandela Bay and the Sarah Baartman region were the first 2 hotspots when the second wave started, but the infection rate in these 2 areas has shown a continuous decline over the past 2 weeks. But the Eastern Cape has the highest death toll, with more than 7,700 deaths since the pandemic started. There are currently just more than 5,000 active cases in the province. The provincial government will now give an update on the latest about the spread of the virus.
Nentuthuzelo kusapho lakwam Thethandaba ne-community yakuqumbu ngesehlo sokulahlekelwa kwabo ngutishalakazi umama uzininzi Mthethandaba emva kokuhlaselwa kwakhe yinkomo. Lento isasikhwankqisile sonke kwaye siyacela ukuba abantu bangayenzi into yokudlala kumakhasi onxibelelwano. Life has been lost here. Elakhaya malinikwe ithuba lokuzilela elungu losapho lwalo ngesidima, and the government is working on that to do all the necessary tests, particularly on the cow itself, to ensure that we ascertain what the problem is scientifically. Sikwagqithisa amazwi ovelwano nakwintsapho zabakhwetha abathathu abadutyulwe kwilali yaseJojweni eTsomo. Noko ezi zinto zisishiye simangalisiwe. Siwathembile kamapolisa kuba sele esibonakalisile okokuba xa ebeke u-72 hours bayakwazi ukuyenza loo nto kwenzeke. Siyayazi into okokuba sele umkhulu umsebenzi abawenzileyo ngokuzama ukurhanqela abarhanelwa nabatyholwa nokufumana isixhobo eso esithe sasetyenziswa ukulimaza aba bakhwetha. Kanjalo sikwagxeka into yokutshiswa kwabantu esiyibona apha kumakhasi onxibelelwano phaya kulalali yaseBhazia eMthatha ngenxa yokuba berhanelwa ngokuba imfuyo. Sonke siyavuma ubusela bemfuyo abamkelekanga kwaphela kwaye lulwaphula mthetho. Kodwa bantu bakuthi yekani ukuthathela umthetho ezandleni zenu de kwenziwe isikizi elinjengeliya nabantwana abancinci bebukele. Sakha isizwe esinjani. Into engalunganga zange yalungiswa ngenye into engalunganga. Siwabonile bamapolisa besefikile pha ekhona. Noko amapolisa xa sefikile siyacela uba abantu banike umthetho udlale indawo yawo. Our biggest wish for 2021 is good health for every citizen of our province, because without good health, there can be no better life for our people. After all, it was an anti-colonial activist, Mahatma Gandhi, who once alluded that, and I quote, "It is health that is real wealth and not pieces of gold and silver," close quote. It is a matter of historical records that 2020 is a year in which the entire world was engulfed by the COVID-19 pandemic, which has thus far claimed the lives of more than 1.8 million people worldwide, with more than 30,000 of those lives lost in our country, and more than 7,000 of those lives lost in our province. These are not just numbers. These are people who were grandparents to someone. These are people who were called mom and dad by someone, and these are people who were children to someone. These are people who were relatives to someone, and indeed, these are people who were colleagues to someone. The loss of their lives is a scar that will forever remind us that we were once visited by this deadly virus, which has caused this world pandemic and threatened to wipe out humanity existence. We continue to be encouraged by the people who test positive for the virus and recover from it. More than 161,000 people have defeated this virus in our province, and this should motivate people who are currently infected to fight hard to defeat this virus. We have faith that this year we will overcome the COVID-19 pandemic, and that working with the people of our province, we will begin a process of healing from the after effects of COVID-19, and more importantly, we will embark on a journey of rebuilding our lives. We are extremely aware that the process of healing and rebuilding lives that lies ahead of us will be difficult. But our strength as people is in our solidarity. It is in extending a helping hand to reach out to those of us who cannot stand or walk on their own. COVID-19 has left us with plenty of people who will need a helping hand. They are in families who have lost breadwinners to this pandemic. They are the small businesses that have been affected by the necessary regulations that were put in place to save lives. And they are the men and women who lost their jobs. Today, I want to appeal to everyone of us as private citizens, government officials, church leaders, traditional leaders, business leaders, and civic society leaders, labor leaders, to be ready and willing to extend a helping hand to such fellow citizens so that they can stand and walk again. We have seen a phenomenal solidarity in action during our fight against this virus, with individuals and organizations voluntarily taking care of the vulnerable with food parcels and other essential supplies. We've seen sister nations, NGOs, and individual members in our society donating PPE to help in our cause of saving more lives. We must extend this humanitarian spirit to the task of rebuilding livelihoods. As we begin the new year, we are pleased to share with the people of our province that there is once again good progress in our fight against COVID-19. This is largely due to cooperation by our people who have once again adhered to COVID-19 regulations. If we continue to do that, we will be out of restrictions soon and more economic activity will be allowed. We only have to wear our masks regularly, wash hands and sanitize, maintain physical distance, and stay at home as often as possible to stop the spread of this virus. That is not too much to ask. The ball is in the court of our people to determine whether we remain under alert level 3, whether we move to alert level 5, or whether we move to alert level 1. Kodwa ke into ecacayo yeyokuba funeka amagosa ezomthetho eqinise ngakumbi ukunyanzelisa ukuthotyelwa komthetho. Kwi-roadblock ebendikenda kuyo ngomhla wama-31 kule igqithileyo inyanga enguDisemba, ndibonile uba abantu abaninzi beluphondo ngabantu abathobela umthetho, ngabantu abahlonipha umthetho. Siyayibulela kakhulu loo nto. Kodwa sisenayo imbinana yeminqandandana phaya naphaya yezaphula mthetho. Siyafuna ke into kokuba nabo bengekaqondi beqondiswa babone kuba ixesha esikulo lixesha lokokuba kungabikho abantu abadlalayo ngobomi babanye abantu. I want to commend our law enforcement officers for their sterling work of enforcing regulations. On the 31st of December, 177 non-compliant liquor outlets were issued with fines to the value of more than 188,000. And 1,532 people were arrested for non-compliance with regulations. Ekuqaleni kwenyanga kaDisemba besisekhaleni kutaka inhlanzi ze-COVID-19 kwizithili noomasipala abambaxa bethu Nelson Mandela, your Buffalo City, Sarah Baartman, your Christiani, Amathole, Owar Tambo, later on joined by Alfred Nzo as well. At that time, our newly diagnosed cases were standing at about 1.2 on average, and were over 8,000 active cases. This was largely due to a bad human behavior, and we went back to the drawing board to enforce compliance in the form of a differentiated approach to the management of the pandemic. Our call to those to close beaches, our advocacy on mandatory wearing of masks, and our ban on large gatherings have yielded positive results. Our call to close beaches, our advocacy on mandatory wearing of masks, and our ban on large gatherings have yielded positive results. These were further boosted by the imposition of a new curfew and ban on the sale of alcohol. We really thank the National Coronavirus Command Council for that leadership. We did not take these decisions lightly. We took them in the best interest of saving lives, and that, for us, supersedes everything else. Through these measures, we have reduced active cases in our province from 8,000 at the start of December to about 5,000. Our recovery rate is now at 93%. We are quite happy with that progress as well. All our districts are back to the recovery rate of 90% and above. These are strong signs that we are moving towards the end of the second wave. We're doing our level best to really plateau, to really level the curve. And the work that we're doing on the ground is actually seen out of these outcomes that I'm talking to. We, however, remain cautious because of the uncertainty in achieving personal behavior to adhere to regulations. Hence, we insist that mandatory wearing of masks should continue to be enforced, that our people must continue to social distance, wash their hands, and stay at home. We are also acutely aware of the risk posed by the new COVID variant. In this regard, we continue to protect and strengthen our healthcare system to withstand any form of demand. In the implementation of our provincial resurgence management, there are no red flags that should cause our people alarm. We are concerned about the circulation of misinformation in social media, about shortage of beds and oxygen in our health facilities. There is absolutely no truth to such claims. They are just causing our people unnecessary panic. But we want to appeal to our managers of hospitals, our CEOs. Sometimes you get into an hospital, you hear this story, but you only find out that these things are there in the storerooms, but the management within the system is actually causing this kind of chaos. Be it PPE, so these claims keep on coming. So we would want to really urge our managers to really be agile on this and always act decisively. I've told the MEC and HOD that on all these, whether malicious or not, but we must have consequence management. We can't have people who continue misleading the society, who continue spread lies for purposes of really portraying our government as bad, uncaring government. The oxygen status in our hospital is in the top level of stability. The medicine status is in the same level, and that is the same for PPE status. There is PPE in our hospitals, and people are given PPE according to areas where they work. And we want to make sure that no worker must go to work without PPE. We rather deal with workers who are not prepared to work because they are not given PPE in the health side. So it's going to be important that we work together. That's why we've set up structures and mechanisms in the province that where you see such, report it immediately so that even Premier himself can immediately make a follow-up and find out why there is no PPE in that. So on all follow-ups that we've been making, we realize that there is PPE. So we have a lot in terms of really looking at our management system and in ensuring that our institutions are also properly led. On the matter of bed availability, we are at an increased level of stability, meaning there is no shortage of beds in our hospitals. For instance, we have 4,309 general COVID-19 beds, and our admissions are at 1,788. So there are more than 2,500 beds available. We also made available 637 critical beds for COVID-19 patients, and only 160 are occupied, meaning 477 are available. I must add that only 49% of our oxygenated beds are occupied. So there is no truth to the shortages of oxygenated beds either. We wanted to reiterate that all the regional and tertiary hospitals, including the renovated old Cecilia Makiwane and the Volkswagen South Africa Field Hospital, have wall-mounted oxygen points and the bulk oxygen tanks, which are kept operational 24 hours. Monitoring of tank supply are done by the telemetry online system by AFROX. The installation of wall-mounted oxygen points in Statarem and St. Barnabas Hospital is planned for commissioning this month. Madzikane, KwaZulu, and Midlands Hospital are also under consideration. We have done this already in a number of our district hospitals. These actually bulk oxygen tanks are already existing. The most critical resource to help COVID-19 patients when they are admitted in our health care facilities is our health care workers. They bear the most brand of COVID-19 in the front lines every day. They work long hours, and they have seen the worst that this virus can do. To alleviate this pressure on them, we have appointed 310 clinical staff who have completed their community service. In addition, a further 625 professional nurses will complete their community service training in April and will be utilized on the front lines. We have a challenge in the market of getting nurses, especially those who can mend the critical care beds as well as the ICU beds. So we are working very hard to really make sure that these issues are addressed. I've told MEC and HOD that we must actually replace the permanent posts of nurses that are either retiring or are getting out of system for various reasons. We can't have that one delayed because we need nurses, and part of the reason that we're struggling to get nurses, no one is prepared to leave a permanent job for a contract job. We welcome the announcement by the Minister of Health to bring forward vaccine procurement availability and the start of vaccination for healthcare workers as a priority, the elderly and vulnerable groups, as early as February. There are people who are recklessly spreading falsehoods about vaccine without any share of knowledge about vaccine, telling our people that they should not take a vaccine when it arrives. I think it is about time that our law enforcement looks into such people seriously, because they pose a threat to the health of our people. Our people should trust government as the only credible authority on vaccine and the process that will be followed to roll it out. We will ensure that our staff are trained to achieve a rapid rollout of the vaccine. We will also work with all critical stakeholders to ensure the effective rollout of the vaccination program to stop the risk of a third wave and ease economic disruptions and social impact caused by the stringent regulations. We will henceforth set up a provincial coordinating committee as required by national for the vaccine rollout to advise us on technical, social, and ethical issues related to mass vaccination of our communities. We want to assure the people of our province that our mandated interventions on vaccine and vaccination will be guided by science. We will follow ethical principles and we will ensure rapid implementation to achieve the required level of the herd immunity to prevent COVID-19 transmission and to achieve containment levels towards total elimination of the virus by the end of 2021. The restriction under Alert Level 3 meant the closure of the traditional circumcision season in our province. We agree with our traditional leaders that the December season is closed, and what remains now is to bring home safe all the boys that have undergone the rite of passage to manhood. Our monitoring teams are hard at work with the traditional leaders to monitor all the boys that have undergone this process. When they come home, there will be no festivities because that could lead to new infections. Sichilo ba social gatherings, imicimbi, imigidi, njalo njalo. Sinoloyiko lokuba zingadala usasazeko lwale ntsholongwane kakhulu. So siyabacela kabantu sesibacelile savana into yokuba amakhwenkwe makahlanjwe, abuyiswa yalwe ngexesha elifanelekileyo kulandeliswe imigidi yabantwana ukuzalisekisa isithethe sethu. Our teams have tested 4,878 initiates for COVID-19 and 239 returned positive results and were placed under isolation measures. Sadly, we lost 11 initiates to a variety of complications that are not associated with COVID-19. Ayamkelekanga lento yoba sibe nabantwana abasweleka kuba be-dehydrated. Kudala lento siyithetha yokokuba akukho ndithi abantwana mabanganikwa amanzi. Abantwana bangoku abafani nabantwana bangaphambili. We are all subjected to ukutya okulula kwala maxesha. Abantwana bangaphambili siyayazi ba imeko ezinje babekwazi ukumelana nazo. So siyacela into yokuba iingcibi abantwana bona uqobo lwabo babakhona bangafuni ukusela amanzi ngokunokwabo ngenxa yokwabe sithi bafuna ukubamba isiko. Siyacela ba abantwana bangayenzi lonto. Ndikhathazeke kakhulu apha evekini xa bendihambele ikhaya lakwaGolela phaa edutywa eliluze umntana walo obesenza ugrade 12, a rugby player, simply because the boy was dehydrated. Father has done everything. Father has been there. Father has been supporting the child. I really felt so bad. Even the day that the boy passed on, Father was there from 8 a.m. until 1300 hours. But the boy, after 4, was almost succumbing to this dehydration. Utata wakhe wamnika ngokwakhe amanzi at some point ukuqinisekisa into yokokuba xa esiva uba ingxaki ngamanzi umntana uyawafumana amanzi. Siyacela uba le mcimbi wamanzi siwunyanzelise abantwana bakwazi ukunikwa amanzi afanelekileyo alingene ukunikwa abakhwetha, so that singabi nabo abantwana asibaluzayo ngenxa yezo zinto ezinjalo. We pass our deepest condolences to all these families. These are deaths that should have not happened. These are deaths that should have been prevented. Lento ithetha ukuthi usemninzi ondonakele ekufuneka siwulungisile singurhulumente kulo mcimbi wolwaluko, sibambisene neenkosi nabazali babantwana abaya esuthwini. Ndithetha nje kukho abakhwetha abangamashumi kwizibhedlele zethu bengeniswe zizinto ekungafanelekanga ukuba zenzekile xa besiliqhuba kakuhle elisiko lolwaluko. Siyacela, siyangxola, siyakhalima kwakhona abantu abangamadoda bonke mabayidanele into yokusweleka kwabakhwetha nokusuka kwabakhwetha ezibhedlele. Kanye xa ndilapha mandoleke ngokukhalimela into ethi ethendi yabantu abomba abantu abangcwatyiweyo. Phaa kwi-social media sidibana ngezinto ezithethwayo into yokokuba bakhona abantu abomba abantu abangcwatyiweyo ngeemeko zeenkolelo ngeenkolelo, ngenxa yeemeko yokokuba sisazi uba abantu abangcwatywa kakade kwiindawo esisuka kuzo bombathiswe ii-plastics, but phantsi kwemeko abantu abaswelekela kuyo yesi sifo, urhulumente wabona kufanelekile uba ukukhusela ukusasazeka kwesi sifo makuqwalaselwe lo mcimbi. Ndicelile ke apha esebeni okokuba masiyijongele kufutshane le ngxaki, sikhangele indlela esinokukhawulelana ngazo nabantu nezixhobo ezinokusetyenziswa ukuqinisekisa uba laa nto ibinokwenziwa yiplastiki ikhona enye into enokwenziwa ngayo, khona ukuze xa kukho isikhalo ebantwini sokokuba abantu xa bengcwatywa neplastiki bayabuya bekhalazela izinto ngezinto njengoko sisazi belele nje basathetha. Abantu bakuthi ke bayakholelwa kakhulu kuloo nto, kodwa siyabacela abantu bakuthi bayazi uba kukho umthetho omiselweyo we-exhumation. Xa ufuna ukomba umntu osengcwatyiwe kukho imithetho nemigaqo elandelwayo. Uba ikhona le nto siyivayo isasazwayo phaa kumakhasi onxibelelwano, siyacela, siyanqanda, siyacela abantu baze ngaphambili xa kukho ukuxakaniseka kweento ezinjalo, sibonisane sithethe. Nabacinga uyenza loo nto mabangaqali ukuyenza kuba bawuzawusenzela enye ipandemic esingayilindelanga yokusasazeka kwezifo, kuba sisazi uba umntu nje noba ebengena coronavirus akungcwatywa lo mntu u-infectious kakhulu. So siyacela ke ba abantu bayihloniphe le nto. So siyayikhalimela ke loo nto uba mayingenzeki uba ikhona into engathi ifuna ukuyenza. Lastly, the marking of grade 12 exams papers has started in our province. The Department of Health has conducted testing in all marking centers since Saturday, when the chief and senior markers came to prepare venues for marking. Positive cases have been managed by the Department of Health, and Department of Education has sent in replacement markers, and all people are undergoing the same testing. We have encouraged all markers to stay in the marking centers precinct for the entire period of marking so that no one may bring infection from outside. The Department of Education will be responsible for daily screening of symptoms and providing a sick bay for positive screens to be taken over by Department of Health. As part of our precautionary approach on the marking for grade 12, We've conducted screening and testing of all our markers. We've tested 2,310 markers already at the marking centers in the province, and 79 people tested positive for COVID-19. All those who tested positive will receive psychosocial support from government, have been isolated and will be kept in isolation until they recover. We wish them speedy recovery. Tracking and tracing of their contacts has started. We are hopeful that the class of 2020 will defy the odds that were stacked against them when COVID-19 hit our shores. They studied under very difficult circumstances, but with the support of their teachers, they will prevail. We want to send our heartfelt condolences to the former member of the provincial legislature who represented the Democratic Party and later Democratic Alliance, Mr. Eddie Trent, who passed on recently. We wish his family strength and fortitude during this time of mourning. We thank him for the role he has played in the shaping of our multi-party democracy and building the province to be a better place through the work he did in the opposition benches of our provincial legislature. We welcome MECs that have been in isolation, MEC Gomba, back, MEC Fundile Gade, MEC for Education, MEC Spogazimani Lucid, MEC for Social Development, who have since recovered from the COVID-19. These MECs are fully back at work and are working remotely. We also send our heartfelt condolences to the Gomba family for the loss of MEC's Gomba mother. Umama wakhe ebena 92 years. Uye lanikezela ixhegwazana siqhethisa amazwi ovelwano kakhulu kula family ngokokuba baphulukane neso sisele senyati. We wish the family strength during this mourning period. Thank you very much.
Thank you, Premier. We will now take questions from members of the media. Let's start with those that are here, and then those that are joining through Microsoft Teams can just raise their hands here or write in the chat box. Then we'll give you an opportunity to ask questions. We will not be able, unfortunately, we won't be able to have time for one-on-one with the Premier, so you have your chance to ask the questions now. Okay, let's go.
Happy New Year to us all. And Premier, even though there's a 90% recovery rate and the numbers are slowly declining in the province, but the death toll remains a bit high compared to other provinces. What can you attribute to that? Therefore.
Okay. You want to take that, or let's take the other question?
No, yes, start with my question.
Okay. That's the one. Okay, let me check with JJ. JJ, you can come in. JJ, can you hear me? Okay, let's keep him. Come here, if you can please answer the
Well, both Dr. Zungu and Dr. Mbengashe, the special advisor next to me, can give more kind of a scientific analysis around that. But what we know, these have been attributed to the challenge of comorbidities. Most people that were losing are people who have comorbidities. It's not just people that were losing so easy. But as we indicated in the last briefing, that we have also asked our local universities, particularly those that are also in the medical science space, to help us dig deep. We need more empirical evidence around this so that we don't just continue making it as easy as that is an issue of comorbidities. But clearly we have not lost people who have no comorbidities. So we have seen how vicious this virus is in those people with comorbidities. So that's a challenge that we have. And we knew the challenge of the health profile of our people. We've indicated that upfront because everyone knew that there is no cure, there is no medication for this. We can only deal with all these other issues. But also the challenge of our people staying at home longer. I know especially in this second wave, many people preferred to isolate at home. Many people preferred to quarantine at home, unlike what we tried to do in the first phase, where we were almost kind of forcing people for quarantine and isolation. So we still believe that there's some gaps there in terms of discipline on individual. The issue of the social behavior becomes clear. And we have been making this plea that we know that as much as we are all susceptible to the virus, but older people are more vulnerable, are more risky. The more we allow them exposed to this, it's going to be a challenge. And many of them are not loitering, are not all over. They are staying in their homes. But young people, we really want to appeal. We can't really continue really observing this juvenile delinquence of some sort, this behavior. It has to stop. That our young people must understand that for them to remain with grandmothers and grandfathers, they must take responsibility. The unfortunate part or fortunate part to them, this COVID-19 is not really doing damage that much to them, but we are already seeing signs of losing also young people, but still young people with comorbidities. So we really very much concerned as a province around the numbers. Indeed, the numbers are really worrying us. They are growing. We've been on average of 100 and above for almost 2 weeks now, observing that situation. We are losing our people. Our people are dying. The only way that we can do to stop our people not to die is to get everyone at home, no one out, no one loitering. At least you do all these non-pharmaceutical protocols. Stick to them, be disciplined, respect them. You must know that as they say, the more you move around, the more you allow this virus to be actually in motion. The only way to fundamentally disrupt the transmission of this virus is to be disciplined, is to be at home, is to observe that. So we are really losing older people, and this is another challenge. Many homes will be soon child-headed households because families have gone, families have been perished. So we really want to plead, we really want to appeal that let's take response, not only for alert level 3, 14 days intervention, but let's actually internalize the issue of responsibility wherever you go. You must know that you might be applying for decimation of your member of the family. The fact that you are out there and you want to satisfy your own interest as a young person. So we really want to appeal to young people to take responsibility. These are our future leaders. You start now. So we expect them to really understand this call that we're making, that this country without them, it won't actually have its future that is intended. So the issue of deaths, it's concerning, it's really up. We almost topping every province, and our people are dying. So we are really concerned. Many other people are dying at home. Yes, we've actually put in place a system of taking swabs posthumously, that even if someone has died at home, that must be done. That's work that health is doing to verify all such kind of information, which is quite critical for us to understand. We're doing it also to protect those who are still alive, so that you don't sit at home and say, this was not a COVID case, it was a natural death. You want to do a normal funeral, only to realize that you are risking everyone around. So that's why we are really making this plea that funerals must comply to the regulations, manage them, keep them into the kind of parameters that have been set up, because we are protecting these other people who are still alive. We don't want funerals that must have follow-ups of trail of deaths simply because people attended. Elder people must be cautious about attending funerals. You can come back tomorrow, even if that was a very close family, you can let it go, come back, So we are really pleading, siyabacela kakhulu abantu emakhaya le micimbi yemingcwabo ezilalini, siyayazi uba kunzima ezilalini ukwenziwa kwale mingcwabo esithi mayenziwe eyi-50. Ndiyavuya nangoba kumngcwabo ebendikuwo namhlanje apha eNgqondorheni kusasa nje umngcwabo was just fully compliant, yonke into yenziwa ngokwe-protocols, and umngcwabo ubusezilalini waqhutywa kakuhle, yonke into yenziwa ngendlela efanelekileyo. So intsebenziswano phakathi korhulumente nabantu, sicela neenkosi, bendine-meeting neenkosi zonke zase-Eastern Cape zone, apho sisenza khona elikhwelo okokuba laa system sinayo ye-traditional leadership siyayazi bi-effective apha eprovinsini, isebenza kakhulu. Laa miyalelo isuka ezinkosini ibheke ezibhodini njalo njalo, mayiqhubeke laa system isincedisa kuba xa into ixoxwe ebhodini kwavanwa ngayo, akukho umuntu ofane elalini aphume ecaleni enze enye into. Nasezilokishini ii-street committees zethu, njengoko usazi into okokuba we also activated our operation Masiphathisane service delivery model. So those ward-based war rooms are meant to assist our people reach out, give all the necessary support that is required during this time. Traditional leaders, civil society, NGOs at that level working together. At a local level, our local command councils. At a district level, our district coronavirus command council working. All of them working together with the provincial coronavirus command council. So we're really pleading, we're getting that system in place, and it has been working. We've seen it. That's why we are able to extinguish fires easily where we see some outbreaks. I'm not sure, Doc, if you would want to elaborate more on this issue of deaths. You can come in.
Maybe, Doc, you should also take the question from Rahim on the vaccine that I sent to you.
Okay.
Yes.
You can move over.
Well, that was a briefing from the Eastern Cape. We'll have more news headlines after this. Let's take a